Sorry, guys, I don't know what happened with the live, but we're back, and we're gonna wait for Sankofa Yoga to come back in. Technology is interesting on a Sunday, so we'll see how well this goes. It says we're live, and it says Sankofa Yoga is watching this live video, which means they should be coming in. Connecting, and can you hear me?
Yes.
Yes.
Okay. I was just saying technology is being funny on a Sunday. I don't know what's going on.
Yeah. And we were probably frozen for like 2 minutes. So I don't know if you were saying anything, but we couldn't hear a thing.
Okay, yeah, like the comments were scrolling, but you guys were frozen, and I was moving, and I was talking. I don't know what was going on. But the conversation was getting good. I feel like we missed something. I think we were talking about COVID testing, and then the next question was, can you guys reproduce this, this model in other communities? And I think another question was, do you offer services just to Maryland residents? That was another question I saw.
Yeah, not just Maryland residents. If you have commercial insurance, like we've been getting a lot of folks who've been out of town or away for college, and their parents is like, you get a COVID test before you come home. So we've been getting a lot of those from out of staters as well. So typically with a lot of the commercial payers, Aetna, Care First specifically, we have Care First contracts, Blue Cross contracts, Aetna, so forth, Cigna. So we can take, if you have a commercial payer, we can take it from, essentially from any state. For those who have Medicaid, it's a little different. It's typically specifically to that MCO or the managed care organization. So, that's a little different with the Medicaid option. We are registered with Maryland Medicaid. We're not registered yet with DC Medicaid, so we can't take those patients. As far as Medicare is universal, so we can take all Medicare patients as well. And then we also can take, obviously, uninsured. So if you're uninsured, we want to do self-pay options. We have that available too.
And so telehealth is an option. So
yeah,
even if you're not visiting Maryland, wherever you are, virtually.
Oh, so still virtual in some capacity,
Yeah.
I did remember something we were talking about earlier. I think as it was freezing, I think we were talking about, I guess, just the importance of, what you guys are offering now, Sankofa Health Center in the middle of a pandemic to communities that have already disproportionately were affected by, diabetes, high blood pressure, the whole 9 yards. And now we have to, suffer, through this pandemic and still have the unfortunate, communities of color being affected disproportionately by COVID. I guess you just speak a little bit more about the importance of, just the work that you're doing for communities of color, and I guess where do you see this going? 1 year, 5 years down the road.
Yeah. Honestly,
well, it's been 2 weeks already, right?
Honestly,
a week or two.
A year and a half ago, I would have never thought I'd be, opening up a health center, but I think, for me, I kind of take my action based on my spirituality. My grandmother would always say, service is the rent you pay to live on this earth. And I dedicated my life to that mission many years ago. I decided to, and I'm going to continue to dedicate my life to that mission. And so whatever God plants on both our hearts to pursue that can be a betterment of our community, that's my call to action right there. And we're going to continue to expand and provide as much as we possibly can within our means and with our limits. And we're going to keep, uplifting our community. I'm inspired by a lot of people. There's one particular speech that Tyler Perry gave on the BET Awards years ago. And he said, why everyone was arguing and debating Oscar so white and debating about getting a seat at the table, I was in Atlanta building my own table. And that always stuck with me because I knew that I'm not, and same thing with my grandmother, who started the Children of Mine Community Center in Anacostia, Southeast DC. And she never took a dime, ever. And she never did that because she didn't want the federal government to dictate how she could have an impact and how she could serve and give back to her community. And so I think about that, and I realize that for us, it's like, we want to continue to uplift and serve and give back to our community as much as we can. we're going to create our own narrative. And that's what we've been trying to do, is create a narrative for our people, you know, for us, by us, thinking about Damon, John, and Fubu. But it really is. It really is. And I'm inspired by that. People who, you know, like, I even go back to Tyler Perry when he was talking to Kenya Barris, and Kenya was like, I can't stop thinking about, you know, the critics and everything else. And he was like, I don't give a damn about them. I care about how my people see me and how the impact that I have on my people. And that's the way when I wake up every day and I think about that. I think about how Sankofa can be a better source and be a direct source for the betterment, for the healing, for our culture, for our community. And that includes the Black and brown. That includes the underserved and the underrepresented.
And I would add to that is when it like the faces of health and wellness, we know has been just not fully portrayed by all folks. We, you know, we understand that. And so even like we service everyone. We just want people to know that we can do this as well, right? So this is not exclusionary.
No.
Now, but we do have a focus because there is a, you know, there's a lack that's happening, right? So we do have a community focus. We have an interest. We have a, you know, like we have a space, a demographic that we are trying to serve, but we are open to every single person. And when they come into this space, whether or not it's yoga or health, they also need to understand that we do this too. And so when you see that and you do that, we are so grateful and so thankful for the folks who will continue to support us, who don't look like us, because they are like, I've never seen this, and I enjoy it. I love the vibe. I love you all, right? And so that creates like a snowball effect of just what we envision ourselves or how people view us, because if they don't see it, they can't believe it the same way, you know, if we don't see it. And so when we have people from different communities that may not like even culturally, like internationally in the space, is that if they can see this too, is that it allows the face of wellness to shift, that everyone plays a role in it. Whether or not you see, if you only had white doctors your entire life, and so you believe the words, you know, are Bible, right? And that's exactly what you have to go by. Or that we don't have the intellect or so to, you know, to discuss wellness. Our marketing spaces, or even just the way that we publicize ourselves, is that we showcase different people. If you go to the health center, our photos are Black and brown communities, every other type of communities. We talk about sexuality. Like, this is a space that is inclusive for all, because we don't see ourselves. And we are coming from our backgrounds, of course, of inclusiveness and specifically community. I don't play that. When I say like, we don't tolerate injustice to anyone. And so we hope to create spaces that allow folks to do the same and know that this is a safe space. Health, wellness, mental health, all of that. This is a safe space for everyone.
I think that's definitely one of the most powerful things that I notice about one, Sankofa Yoga, and even Spiritual Essence, and any other Black-owned, you know, wellness center of whatever kind. They're kind of like a diamond in the rough within the midst of everything that looks the same. It makes them stand out even more. Because for me, when I first got exposed to yoga, I was in a certain, you know, space that it just seemed like, to me then, it seemed like that was all yoga was back then. Now, when I, you know, transitioned into Spiritual Essence and being in a Black-owned space, I'm just like, wow, this is what this feels like. I couldn't imagine then that this is what you know, a space like that could offer. And then moving into this conversation, having a wellness center or a health center, you know, providing services for people of color, I think from some people that's just going to be a hard pill for them to swallow. That's a metaphor in itself, for them to understand getting services by people that look like you. So I think that's extremely powerful, and that's going to go a long way. And I'm glad that that's the mission, or that, I guess, part of the message behind what Sankofa Health Center is just, you know, kind of spinning that narrative and just, did have a couple people chiming in. If you all can just say hi, or if you have any questions for Marcus and Tamisha while we're still here, definitely want to get your questions answered. I guess we can kind of segue into like a Q&A session with the audience that we have, if you guys want to jump in. But do you guys have anything to add that we might have missed out? I feel like we covered mostly everything, but if there's anything else you want us to let us know about Sankofa Health Center, or anything you guys are offering.
Yeah, so I definitely want to say, just from a business standpoint, from an entrepreneur standpoint, if there's anybody that is thinking about you know, jumping into entrepreneurship, or, you know, want to talk about ways they can grow and expand, please reach out to us. You know, I one of the things I love the most is sitting down with entrepreneurs and talking about ways that, one, they can grow and how they can expand. I think God has blessed us so much, and I just want to continue to share and spread that message of entrepreneurship, especially for people who look like us, who may not have access or understanding or any of those things. If you want to just sit down and just talk through some ideas, please reach out to us, and we'd love to just sit down and talk to anybody.
And when we reach out, I'm going to say use the email, okay? Not DM. So info at Sankofa Health or Sankofa Yoga?
Yes, either one is
okay.
fine. Yeah. So you can email us. You can email me directly, marcus@sankofahealthcenter.com. Definitely reach out, and we can set up a time to you can come past the space and we can sit down and talk. But I love talking to entrepreneurs. It's one of the things I love doing the most.
Yeah, you got a lot of love. Congratulations to you both. This is needed in the Black and Brown community, which it definitely is. This is wonderful. Congratulations. So, with no said, thank you guys. Yeah.
Thank you.
So, yeah, thank you all for joining in. That pretty much wraps up most of the questions that I had. You guys kind of answered most of my questions without me even asking. So, this conversation been great. Britt Sankofa, Britt is actually our program director at Creative Suitland. She asked, what does the future hold for the center?
What does the future hold for us? Like I said, a year and a half ago, I never thought I'd be, opening a health center. I don't know. For me, it's like I allow God to order my steps. I really walk in His path, and whatever He has planned for my life, that's next. But I really just try to focus and prove to Him that what He's given me, I can handle, I can do, and I'm going to do it to the best of my ability. And He just continued to drop stuff in my lap, and we just take it from there. So
like, okay,
right, okay, thank you. So honestly, I don't know what's next. I really don't know, but I'm looking forward to whatever God for growth. Yeah,
we're excited for growth.
Yes.
For growth in shifting the narrative.
Yeah.
And that is just so much, and there at the top of the year, mm-hmm. We're making it our mission specifically to really address health in so many other ways through like programmatic type of styles. Like we talk about women's health, really, really addressing it head on and being in the forefront. Like we mentioned, the doula services begin next year as well.
Yeah.
So, and I know we say next year, like this year didn't just like kind of fly by. Maybe it did or dragged. I'm not sure. But 2021, in terms of what the health and yoga center space is expanding, is providing more services in different ways.
Yes.
So hopefully becoming like your, lack of a better term, one-stop shop in the spaces that you're able to visit here, go here, so, and also grow with you. Like some of our students become pregnant, right? And then they become prenatal students, and they become then they come to the health center. Yeah. It becomes like just a system of just building community, and we know the families, right? Like we've seen families, and we've seen students from yoga transition into now I'm helping with their babies, right? So we're just seeing some things. It's like just the growth of community. So to answer that, like in addition to Marcus, is what is the future? Is continuously growing and helping the community. Whatever happens out in the world, please believe that we are always thinking about that in a call to action, and we're going to just receive it, listen, and have our steps ordered. Yeah.
Speaking of baby care, we did have a question. Does Sankofa Health Center offer pediatric care?
18 months and older. Yes.
Older.
Yep. No pediatric vaccines. We do not do pediatric vaccines, but we do care 18 months and older.
Yeah.
Okay. And then what providers currently have on staff? Yeah.
What providers do we have? I'm assuming that means what type of providers we have.
Yeah.
So we have certified nurse practitioners. Nurse practitioners are phenomenal. And to kind of just give you some context, nurse practitioners are advanced practitioners. They're almost, I would say, so hopefully no MDs are in here, but they are almost identical to a family physician. They can almost do every single thing a family physician can do. They are and receive advanced training. They can prescribe. They can do it all. They're phenomenal. And so we have 4 nurse practitioners on staff who are phenomenal. And then in the new year, we are going to partner with some GYNs in the area. We have a couple that we've been talking to. So we're going to partner with some OBGYN medical doctors who are going to work out our space as well. And we also have a holistic nutritionist,
Yeah.
Debbie, who's phenomenal. So please definitely sign up with her. And then we also are going to be, Tamisha's going to be building out a mental health component to the practice. So we're going to be bringing on a licensed therapist as well. Yep.
So really, I mean, I feel like it already is a one-stop shop, but you're really about to make a one-stop shop.
Yes.
That's really
I,
dope.
I, it's all about community. Like, you go where you're comfortable, right? Like, and so, and like, we know, for those who have been scoping out and trying to find, we Google, like, where can I find a so-and-so doc, like Black therapist, Black, you know, like all of that. You're just looking like you have to add the word in front, right? It's like, oh, you know exactly where to go,
Yep.
right? Like, or even if it's not like Black centered or brown centered or just completely culturally competent. That's really what we're about, is cultural competency.
Mm-hmm.
And cultural competency varies from not only race and ethnicity, but to religion, sexuality, like a socioeconomic status. Cultural competency is exactly like what we like strive for. So if you're ever looking for someone that understands you, understands your makeup or your current standing, then this is where we want Sankofa to be, like our home.
Mm-hmm. Yep.
Yeah, I mean, I feel like most people, I guess most people, I guess some people in here have been to Sankofa Yoga at least, but I'm pretty sure they know the vibe there and how infectious and heartwarming and comfortable that space is. I can only imagine what the Sankofa Health Center side is. I'm pretty sure it's um, just as comfortable as the yoga space. And then someone said, "Oh, this is Holly's mom. Hi, Malika. This is Holly. Please connect with them with Holly. Proud of you guys." Oh, okay. So Holly, Dr. Holly, she was the pharmacist who was doing our wellness chats previously, and she's a pharmacist who just moved to this area. She's a Black pharmacist. She's a mid-20s. I don't know. I don't want to say her exact age, but she's like a mid-20s pharmacist, and yeah, she would definitely love to connect with you all, I'm sure. I think she actually came to the wow, what was that? It was the workshop for the rainforest, I want to say last year.
Oh yeah,
Yeah.
Amazon Flow.
The Amazon Flow.
Yeah, she came to fell in love with the place. She always asks me about it, but I'll definitely connect you guys. She would love to I don't know, pick your brain or talk with you guys at some point. Yeah. But this,
Right.
like I said, I had like a whole list of questions. You guys literally answered everything in terms of the specifics with Sankofa Health Center, like COVID testing and your services, question about primary doctors, insurance. You guys answered like everything. So I'm just trying to fish for questions in the chat. So let me see what any questions you guys want to ask Marcus or Tamisha Ponder. Please put them in the chat, and then we'll wrap up shortly. But do you guys have anything else to add? Anything we left out? Or how can they reach you guys? Give them like the website information, everything that they can contact you guys.
Yeah, so both our sites are pretty much kind of like connected. So you can either go to sankofahealthcenter.com or sankofayogacenter.com and just, they are connected. We have on the yoga site, we have everything. We have all our yoga services, our wellness services, our Reiki, Thai massage, which has been really great. Sound baths, meditation, private sessions, we have it all. Reiki, and then Tamisha is building out Doula, so she's starting her Doula services January 1. And then we have on the health side, we have everything. So obviously, your urgent care stuff, the primary care. And then we also are building out women's health as well. So SankofaYogaCenter.com or SankofaHealthCenter.com.
And both the organizations, or the same organization, both of the websites rather, offer virtual options. So we understand we want folks to be comfortable. Even if it's in the comfort of their own home, we have the option. I also want to remind folks that if you are, if it's first time at Sankofa, we do have a $25 2-week special, unlimited. So if you're a new student, right, 2 weeks, unlimited for $25. I don't know where else you're going to get that, right? Okay, so for $25, 2 weeks straight, nonstop yoga, $25. And then our Black Friday special, which is going up until Cyber Monday, is we're offering 15% off of memberships and class passes at this moment. So like I said, all of our classes also come with a virtual component. A membership comes with great perks. If you're interested in seeing a nutritionist or our wellness side, then we would definitely encourage membership, because then you get more discounts on the services and you can get more and more of them. So on the yoga side, that's there. Health side, we already said it, right?
Yeah.
Okay, so yeah, SankofaYogaCenter.com or SankofaHealthCenter.com. Now, if you go to our page, if you go to the link in our bio, We have like a list of all the services we offer. You can always visit that link if you ever forget our website.
And then Malachi, we can definitely do this again. So if anybody has any questions or, we can definitely we can always come back as well.
Yeah, this is the thing. That's just what happened when we did our first wellness chat. We just did like a general wellness chat, and there was just like so many other questions, and we're like, oh crap, this is only like an hour, so we had to come back for a second edition. So we can do another, just make it more specific about a certain topic, so we can elaborate on that specific topic. I did have a question that popped in at some point. I don't know where it is, but a doula. Can you explain briefly like what is a doula? You say you offer doula services, or will expand those services. Could you just give, I guess, for those who get what a doula is?
So so with the expansion of the service, so we also as part of the yoga science, we have offered prenatal yoga for over about a year or so. Now, in terms of transitioning into doulas, a doula is someone who is a non-medical professional who provides emotional, physical, and spiritual mental support during gestation. So in terms of your notification of pregnancy, all the way up until delivery, labor and delivery, and immediate postpartum. So that can include discussing nutrition, discussing your birth plan, how you would like to give birth, or where you would like to, the support for childbirth education, lactation, support with family or partners, meal prepping too, postnatal, labor and delivery, specifically comfort measures that help the birthing person be in a comfortable state. And when we say emotional support, is that even if there's someone you just want to hold on to the entire time, or someone that can help and serve as your advocate. So many times, some of our clients, moms, birthing persons, they'll be in labor or in a space and they have no idea what's been administered to them, or not understanding what has been given. And so we step in as the advocate to kind of like translate, like, okay, well, this is Pitocin, this is an epidural, would you like this? And so we offer you your rights, which most hospitals don't really go over them, because they kind of push you out in a sense, because it's they got to get the next person in. Now, in terms of doulas, is that we provide that comfort where they're feeling pressure. The last thing anyone who's delivering wants to think of is to make a life and death decision at this moment. We're assisting, and also doulas also assist in home births or natural births. All types of births are welcome for doulas. So for you, because you need that support throughout the pregnancy, dealing from nausea to headaches to sciatic nerves. All of those spaces is that where the transition into prominent doula support, starting primarily around 26 weeks or so, moving forward. That's where we're going to, when we say expansion, is that this includes fertility doulas, as well as prenatal or birthing doulas, as well as postpartum doulas. So, yeah, I think that was hopefully understanding of what doula is. And you can also visit our website to have a better understanding on the doula page to see what it entails.
Yeah, definitely. I'm pretty sure someone knows someone who's pregnant or is pregnant, maybe in the chat, and can definitely use some more information about that. I love this name. It says Red Hippie. I love whoever's name that is, Red Hippie. Do you recommend beginning yogis to start in person or virtual? And they said, does it matter?
So that is a very good question. That's a great question. Malachi, you and I both can chime in. So what's very interesting about it is that I actually started yoga way back when via DVD, right? So that's when I started via DVD before So I have to remember that that's how I started too. So I completely understand if you want to start virtually, right? However, it wasn't until I got in person where I realized what I was doing. Probably not. Like, I learned alignment. However, it didn't stop me from enjoying the practice virtually. So as a first timer, my appreciation happened virtually, but my understanding happened in person. But we understand this is a pandemic, and if you are not comfortable coming in, we work with you. Sankofa yoga teachers, we are working for modifications or alternative ways. That if you are new, do not be frightened. None of our classes are super advanced. We will not have you on your head in that space. Is that it is simply, everyone will create modifications for you. So if you are feeling tight and you're virtually, press unmute on that Zoom and say, hey, Malachi, my left leg is hurting. Can you give me something for that? As if you were in person. Now, virtually, our virtual classes are interactive. They're live streaming. You can interact and talk with your teacher. It is not it's not where it's a pre-recorded class and you can't engage. So we're all about interaction. So whatever you feel comfortable with, because we all know that experiences are built on comfortability. So if you're uncomfortable and thinking about the pandemic the entire time, then don't come in, right? Like, it's okay. We want you to feel comfortable. If you want to be in a space, because we're about mental health and wellness space, however you feel comfortable doing so, Sankofa will be sure to provide access and assistance the entire way.
Yeah, you answered it. I mean, it kind of just speaks to the time that we're in person or virtual. I mean, if you're not comfortable, go take a virtual class, but know that being in person, that in-person experience is completely different, and you can correct yourself, or the instructor can correct you, and it's a little bit personal, and you feel the vibe, and then just get a different experience from it. So it's definitely two different things, but hey, we're in a pandemic, so
Yeah.
Ira says, do you or will you offer prenatal care such as midwives and doulas? I think you answered the doulas, but will you offer midwives as well?
So we got into the discussion of OBGYN partners. That is to be determined in terms of how soon. We do have some really great partners that we're working with.
Yeah.
Our prenatal care, specifically for Sankofa Yoga and Sankofa Health, starts immediately at the moment you feel comfortable. Oh, there's our dog. The moment you feel comfortable. So if you're starting off at prenatal yoga and that's your first entry into the space, and once you start to understand more of your growing pregnant body and you want to move into, let me discuss with the midwife, or you want to seek doula, we just hope to be that place where you have all your answers, all your questions answered.
I guess that's in itself is a whole topic within itself in terms of prenatal care and how does that mix in with yoga. Can you just dispel the myth that pregnant women can't do yoga? Because I think some pregnant women might think, I'm pregnant, so I can't do too much, or I can't bend and fold like that.
So what's very interesting is that the majority of prenatal yoga students are first-time yogis. So the first, everyone in my prenatal yoga class, with the exception of maybe one or two, out of each cohort, we do it in a cohort style. Out of say nine students, 8 of them, this is their first time doing yoga. Most of the time, yoga is recommended from your health provider because it's low impact. It's something that keeps you moving and still getting your 30 minutes of exercise daily, but also is perfect preparation for labor and delivery and childbirth. So it comes with recommendations mostly, and then once you get into the class, you're like, wow, what have I been missing, right? And they enjoy that time with themselves, that time where they can also chat with other expecting moms and parents. We have a partner class at the end of the cohort too, where you can bring a loved one, your partner or so, and they all share information on how this pregnancy journey has been. So yes, you do not have to be experienced, because we do not do all of that in prenatal yoga. Prenatal yoga is for you. You do not have to worry about doing anything outside of your norm. It is a perfect coping mechanism for throughout your pregnancy that addresses nausea, hip dysplasia, everything that you're experiencing, swollen foot, indigestion, heartburn. It's the perfect remedy for it.
And we have our last question from Red Hippie again. Do you offer a yoga class specifically for beginners?
Yes.
And yes, we do. Oh, yes, we do. Go ahead.
Yes, we do. And she's on this call right here. She's our teacher, Shira, teaches our yoga for beginners on Tuesdays at 6 p.m. And as mentioned too, we still they're also beginner friendly. Our classes throughout the week. And so honestly, the majority of our students that come through the studio, they're first time yogis, period. Yeah. Like I said earlier, we didn't know that we did this stuff, right? Or at least not, you didn't see yourself there. So people are like, can I try it? Can I try yoga? A lot of our community are all first timers, and they just fell in love with the practice.
Yeah, I love having first time yogis in my class, because it just makes me even more excited about teaching, because I love seeing their face when they see me, and then I see them. I'm just like, we're all excited because they're not used to seeing this face and teaching anything.
Yeah, right.
And even I'm still not used to it, even though I've become more accustomed to it now, being in different spaces that provide those offerings, which is amazing. But yeah, I mean, it's a great experience just to be in a community with people who look like you and, flowing and doing all that amazing stuff. So the questions have slowed down. I think we've covered everything that we can cover as it relates to the health side. And we did have a lot of questions about yoga as well, which, like I said, I think we should ponder about there we go, ponder. I think we should ponder what we should talk about next, or if we want to schedule something else, just pinpoint it so that it's, specific about a certain topic, because we can go on and on about wellness and health and mental health and yoga. It's just so much to talk about, so many different pieces to kind of have a conversation about. So I wanted to just wrap it up here and just give you guys the opportunity just to say your last piece to the community, whatever on your heart.
On your heart.
No, I was just going to say, thank you for this opportunity, Malachi. I think, conversations like this are super important. I think we need to continue to have these conversations with our community. And I'm thankful for spaces like Creative Suitland, for Sankofa and all the spiritual essence. We name drop that place a lot, because we all are products of the previous place that we came from, right? So appreciative of those spaces. And I hope that, somebody took something from this conversation, and that we can continue to be a conduit for service, a conduit for the word, and for what we stand on. So thank you.
And I would add and close it out is that during this time, partnership, it's like we cannot be afraid of working together.
Yeah.
This pandemic has strengthened relationships between us and other yoga studios, other wellness spaces, other health centers too.
Yeah.
So we mentioned spiritual essence, but I have to give much love and appreciation also to Shabbat Yoga and Replenish Yoga and Meditation. We've worked together like very, very closely throughout the first when everything shut down, and we leaned on each other for assistance. And these are all Black businesses, and so we want to encourage same for Creative Suitland. Like there is nothing wrong. It's everything right with working together.
Yes.
And we want that to be what we lead to, is that if we talk about community, we really mean it. There is no competition. We are all here to help. Yeah. And so just reach out to us. We're here to assist in any type of way.
Definitely. And that's something we had to learn very, very early on, within the first week or two of the pandemic. Once we realized that this was going to be longer than 2 weeks, which we're now in month 11, who knows? But building partnerships and strategic partnerships with other arts organizations or wellness centers, yoga centers, that's been the highlight of our year, I guess you can say. We started with doing writing to wellness workshops. That took off and became like an Eventbrite sponsored event for their Do Well Wellness Week that they did back in September, and that gave us like an audience. So we're doing like workshops from like Ireland and Australia, something that we've never done if it wasn't for the pandemic. So it's kind of like the blessing within the virus, if that makes sense. So that's something we definitely had to quickly learn, and that definitely has benefited us in the long run, in terms of our growth moving forward, in terms of programs, some of that good stuff. But if anyone's interested, I know we have like a mixed audience, some of your audience and our audience as well. So if you guys are interested in anything that we're doing in terms of arts and wellness and how we blend the two, feel free to visit us, creativesuitland.org. We have our calendar on the website. Feel free to reach out to us if you have any questions. We're going to be offering some really fun, innovative programming at the top of next year. We have some sponsored programming, which we're really excited about to really launch next year, and which is our way of linking arts and wellness. And I think that's pretty much it. I don't want to go over I know this thing is going to cut off probably like any second, but thank you all once again, Tamisha and Marcus. This was extremely fun. Can't wait to do this again. Thank you.
You.
I feel like I'm ending a yoga class right now. So, peace and blessings to you all. Namaste.
Thank you so much for having us.
Thank you.
Yeah, thank you guys. See you soon. Be safe.
Bye.
See ya.